still have the $250 drug deductible per family member for the formulary brand name and the non-formulary brand name drugs. So the question will come up, how do I know which plan will work best for me? Well, we're going to determine when we have one-on-one calls, what your medical needs are. If you know that next year you're going to go get your bad knee surgically repaired, or you just have a lot of serious medical conditions and a lot of treatment, a lot of testing, or for a woman who's a little younger, who's thinking about starting a family, you know you're going to have large medical bills. So you're going to probably lean more toward a platinum level plan because you'll have the least amount of out-of-pocket cost at claim time. On the other hand, if you're the person in the family that never goes to the doctor, you can get by with a bronze level plan, or we can look at the levels in between. But the one variable that you have to keep in mind is you can look back over the last few years and determine what your medical claims have been like, but you don't know what's going to happen in the future. In a moment's notice, you could be diagnosed with a serious medical condition. You can have an accident. You can just have a sports injury or some other kind of an injury that's going to require surgery or a lot of physical therapy. So these are things to keep in mind when determining what plan makes the most sense. Let's talk about Covered California. When the Affordable Care Act, or Obamacare, was put together, they set it up where every state has to have what's called an exchange. And in California, that's called Covered California. Covered California is like a third-party administration company that makes plans available through different insurance companies. And as we mentioned a few minutes ago, you can get plans through Anthem Blue Cross, Blue Shield of California, Health Net on a limited basis, and Kaiser Permanente. Plus, there's a few smaller local HMOs called LA Care and Molina Health in the Los Angeles area. If you're in San Diego or up in Northern California, you'll have access to some local plans in your area. Now, the plans offered by the major insurance companies that I just mentioned are exactly the same as if you go direct to the carrier. The benefits are the same and the premiums are the same. So the question would come up, why would one want to buy a plan through Covered California? Well, if your income is between 139% and 400% of the federal poverty level, you could qualify for a premium subsidy from the federal government. And the premium subsidies are based on your modified adjusted gross income. When you do your taxes, the first thing that goes on there is all your different sources of income. Then you have all your deductions, which you subtract from your income. And when you do that, you get your adjusted gross income. Well, to get modified adjusted gross income, you have to add back in some of your deductions, things like income from rental properties, income from investments, income from mom and dad, gambling winnings, inheritance, a relative died and left you money. That gets added back into your adjusted gross income. And if your income based on your household size is between 139% and 400% of the federal poverty level, then you will qualify for a subsidy. Let me give an example. Let's say you're a family of 4 and your household modified adjusted gross income is $40,000 a year. And keep in mind, I'm just making up numbers right now, so don't hold me to these numbers. Let's just, again, make believe that the subsidy that you would qualify for is $500 a month from the federal government, and the total premium is $700 a month. And again, I'm just making up a number, so keep that in mind. So every month you will pay $200 and the federal government will send a check for $500 to your insurance company, whether it's Blue Cross, Blue Shield, Health Net, or Kaiser. Now, what you have to do is project what you think your income is going to be in 2015. Well, what happens if during the year you get a pay raise? And now instead of making $40,000, your income is $50,000. Well, as soon as there is a change in your income, whether it goes up or down, you need to get on the phone with Covered California and let them know so they can make an adjustment to your subsidy. If your income goes up, the subsidy goes down. If your income goes down, the subsidy goes up. But let's say you forget to call Covered California and let them know that your income has changed. Guess what? At the end of the year when you file your taxes, you might have to pay back some of that subsidy. And if your income ends up exceeding 400% of the federal poverty level, you're going to have to pay back 100% of that subsidy. And that money is due on April 15th, and you're going to send a check to the Internal Revenue Service. And if they don't have that money by April 15th, they turn on the interest meter, which means you're going to owe a whole bunch of additional money in interest if you don't pay that back. Now, on the other hand, if your income goes down, then you will get money back from the federal government when you file your taxes. So don't forget to call Covered California if you have a change in your income, either up or down. And you might have to call them every month. And let me give you an example of something that could be a real problem. Let's say you sell real estate and you're struggling all year. You've barely made any money. And then all of a sudden in December, you hit the mother lode. You sell a house and make a huge 5-figure or 6-figure commission because you sold a multi-million-dollar house. Guess what? You're going to pay back all of that subsidy that you earned that year. So you need to take that into account when we discuss subsidies, and we will do that when we have one-on-one calls with all of you. The other thing that you have to do for Covered California is provide proof of citizenship. That means we're going to need a copy of your driver's license or your birth certificate, or if you're not a U.S. citizen, a copy of your green card or your visa that shows that you're in this country legally. Otherwise, you cannot get coverage through Covered California. And the other point I'm going to make is if you think your income is like right on the border of that 400% of the federal poverty level, or it might be slightly over, then do not waste your time trying to get a subsidy. Just buy a plan direct from the insurance company. Last year, there were a lot of challenges with Covered California. When 500,000 people go on their website all at the same time to sign up, guess what? That website crashes. Well, one of the other things you need to do if you're going to get on Covered California or you already have Covered California you want to go to their website, which is www.coveredca.com, and set up an account. That is important because if you have an account on there, that's where they're going to provide you with information that might be missing or documents that you need to provide to finalize your coverage. Now, we've already talked about the premium subsidies, and there's one thing I haven't mentioned yet. If your income is below 139% of the federal poverty level, you will be moved to Medi-Cal. Now, when you're on Medi-Cal, you don't pay a dime for the coverage, but there is a very limited number of doctors that accept Medi-Cal. And these doctors are not located in your middle and upper middle class communities. They are located in the lower class communities. So keep in mind that if you live on the west side or you live in the San Fernando Valley or the South Bay, you might have to travel a ways to get to a doctor that accepts Medi-Cal. Now, one other thing about the subsidies, if your income is between 139% and 250% of the federal poverty level, and you are applying for coverage for your family, as grown-ups, you will get a subsidy, but your children will be automatically moved into Medi-Cal. And there's no way of getting around that unless we just you pay 100% of the premium, and we just do not go to Covered California. You purchase a plan direct from the insurance company. And again, we will discuss all these situations when we do one-on-one calls with all of you. Now comes the fun part, provider networks. And bear with me because there's a lot of information that you need to be aware of with provider networks. President Obama signed the Affordable Care Act into law on March 23rd, 2010. If you have an individual plan or a family plan where the plan effective date was prior to March 23rd, 2010, you have what's called grandfathered status. That means you keep the benefits that were on your plan prior to the implementation of Obamacare, with a few minor exceptions. And I'm going to kind of pick on Blue Shield as an example here. In 2013, their provider network had approximately 68,000 doctors and hospitals in California. Well, in 2013, Blue Shield, Anthem Blue Cross, and Cigna sent letters to every PPO provider, doctors and hospitals, telling them they needed to sign a new provider contract for 2014 and their reimbursement fees were going to be reduced. Well, over 2/3 of the doctors and hospitals in those provider networks dropped out. So on January 1, 2014, Blue Shield's provider network dropped from 68,000 doctors and hospitals to 6,000. Now it's gone up since then because they've added more providers. And right now they might have somewhere between 10 and 20,000 providers. So here's the way the networks work. And I'm going to use this Blue Shield example. If you have a grandfathered plan, you get to keep the 2013 network with the 68,000 providers. If you have an individual or family plan where the effective date was January 1, 2014 or later, then you get the 6,000 member provider network. again, using the example with Blue Shield. If you are on a group plan through your employer,